Nurses Week is a great time to pause and reflect on the impact that nurses have in the community.
I think it is important to pause and really reflect on yourself and see what difference you're making.
It's very important to recognize our nurses. I really do believe in that. This is the one profession where one person really does make a difference in someone's lives.
You know, the role of nurses in our organization is incredibly important. Really, nurses are our heart and soul.
They really kind of are the backbone of healthcare.
We're all nurses, and we're all like in a brotherhood or a sisterhood, however you want to say it.
We meet people at very, very difficult times, and we have an opportunity to really change how they see their future.
You know, our home care nurses work really hard. Each day, you know, they don't know exactly what they may come across.
I think it's more important to recognize nurses on a daily basis and the things that they do above and beyond every day. Sometimes it could be just a smile, sometimes just a touch, but sometimes there's some extraordinary examples that we have, and I think we'll probably see in some of the video stories today.
My patient was a 98-year-old veteran, very proud to be a veteran, and he had congestive heart failure for many years. And he understood the disease, he understood why it happened, but he really had a very, very poor diet. And he would joke with me, and he'd say, well, I made it through all the wars. Those wars didn't kill me. What makes you think my diet's going to kill me? So he had a very distinctive voice. You would pick his voice out of any crowd. So there's a little mini mall in the community, very small mini mall, and it kind of has a center court. So there is a lab in there, and we drop off our blood specimens there. So I'm cutting through, and I could hear his voice, and I said, oh, he's here. Where is he? What is he doing here, right? There he was in center court with about 6 other gentlemen. He had his magnifying glass, he had his soup can, and he had the written instruction that I had given him. And he says, guys, we got it all wrong. My nurse says, and when I heard that, my heart just skipped a beat, because I really felt like I really not only got through to him, but now here he's teaching his peers. And it was just so heartwarming. And really I just stood there in the background just watching him, and really, luckily he didn't see me, because he would have drawn me over there, and then I would have to, give advice to everybody, who weren't my patients. But it really was very, very heartwarming, very, very satisfying.
Beverly's story was kind of interesting because it really exemplified how one nurse going out to teach one patient could then further spread the message to a whole group in a community. So where Beverly went and taught the one patient, he went and taught a group of patients, and who knows how many people that group went on to tell.
Well, many seniors share information with each other. Oh, my doctor said this. No, this doctor said that. So maybe they don't really believe what you say, but they believe each other. And if one of them has success with something, then it kind of proves that it works, that what we're doing is working.
The only thing I knew about the case at the time was that he had a diagnosis of lung cancer and that he was 89 years old. And when I first came to the house to do the start of care visit, I met with his wife and himself, and there was 3 of 5 children there, adult children. When I walked in and introduced myself and shook his hand, I could tell right away that he was a very proud man and very used to being in control of his surroundings. Well, for the majority of the time that I was visiting with him, he would call it his condition. I'd ask him how he was feeling. He said, well, I have this condition. And maybe about a week and a half before he passed away, and he was declining and having much difficulty walking and wasn't able to eat anymore, he said to me, Amy, I think the disease is getting worse. And I said, I think you're right. The night that I had pronounced him, though, we were talking and they were thanking me for having their dad comfortable at end of life, which he was. And that was not the impression that was given to him when he was first diagnosed with this cancer. And the daughter-in-law, whose mother had been on a hospice, said to me, Amy, I want you to know that I was against this up until last night. And she said, my mother was on hospice and it was a horrifying experience for me, but I have to say that you have restored my faith in the hospice program.
You know what, Rose had a lot of ups and downs. She had a lot of problems with her heels. She became septic from them. They did a wind-up deciding to amputate both of her legs to help resolve that problem. And that, you know, really was good for Rose because it avoided, she kept going back in and out of the hospital with those wounds.
Rosemary was, you know, essentially bedbound. Her multiple sclerosis had been taken over her daily ability to function independently. At that time, I believe she had a young child who, you know, who needed more help. And Jackie was able to assist her and her husband at that time in taking care of them and making them have a good quality of life. And Mrs. Reynolds was able to bring up her children. She was able to, you know, maintain a normal household even with her disability.
I have no complaints about Jackie there. She's been wonderful, really. She had nurses come in when I had those heel infections here on Saturdays and Sundays. They changed my dressing and everything. She's very, very good. I couldn't ask for anything better, really. Very nice.
Well, this was a very difficult case to begin with. Was the only child in that family, and they waited 18 years to have him. So it was a very emotionally, mentally, and physical challenge in this case. Family were struggling with the decision to come to hospice, but their immediate goal was for for the child to get better while in hospice program and pursue more curative, aggressive treatments. They were struggling with accepting the decline of the child. He came in our program in April of 2015. From month of April until June, July, patient was slowly declining, and meantime, we as a hospice team, we created an environment and built trust with them. It was very hard because they weren't so open to the hospice, and I don't blame them. Being the only child is very hard to accept that your only child will die. And it was a very careful maneuver to go to their hearts and their minds. With the help of all my 3 managers, Vicky Busco, Donna Henry, and Cindy Charles, we were able to penetrate in their brains and their hearts and build that trust. The best thing how to do that was to just being present in there, actively listen to them, and being empathic. Being a mother, I associated myself and put myself in their shoes many times, and it was very hard to maintain that professional kind of boundaries that were there. And there were many times when I could look at that son and see my son's face, which was very hard. Sorry.
When you see things not go well, it's very hard on all of us. It can tear your heartstrings when things are not going well.
Every time when I was leaving that house, I was giving that son a kiss in his forehead. And thinking about his parents, what they were going through. So the best thing and promise to myself was to help them going through this process. One of the questions they were questioning me was, why our son? Why did God gave it to us after 18 years to take it back? And there wasn't any answer to that question. I couldn't answer that question. I just listened, but in my heart, I was screaming inside. Like I said, I had great team support. And I had a moment that I was falling, especially after he died, this kid died. I was falling back, but the team kind of caught me and supported me, were there for me until I kind of let it go, that I did the best. It's still, and is going to be with me the moment I die.
So Janine has been with this particular family for a number of years. The child started as an infant into the program, was referred for some developmental issues, chromosomal abnormalities.
Well, I got him as a newborn, and my first thought, which I very distinctly remember, was, oh my. He had a diagnosis which they usually don't survive. And so I expected somebody very, very severely ill, and he was very, very severely ill.
We had really, in the beginning, no knowledge of the chromosomal disorder that he had, and she kind of steered us in the right direction, of which doctors to get in contact with and have him seen. And based on her recommendations, we've seen doctors, and really without her, we would have, the ship was kind of going all over the place before we were able to really get steered in the right direction. And I mean, she's been, like I said, she's been pivotal in his care.
The challenge for him is that the diagnosis that he has is so rare, that his major diagnosis is so rare that most children that have that diagnosis, which does not have an official name, is less than 2 years. So he has some unusual things that occur, but he's beaten all of those odds coming through. Things that he's been told he couldn't do, he's managed to do. It's slow progress, but every step he makes is wonderful to see. He's only recently begun talking or saying words. Prior to that, he would scream. Now he'll say 2 or 3 word sentences. It's amazing to see.
The mother of the one child and the grandmother of the infant was, really eager to be able to participate. And in our conversations that we had about Janine's role in the home, she had shared that the older child, who has, like I had said, some considerable developmental issues, doesn't really have a lot of words that he uses. He's not an extremely verbal child, and what he does say isn't always clear, but Janine's name is one thing that he says quite often and very clear, and she shared that story a lot. So, it really spoke to me about how important Janine is to this family and this child, and now the grandchild as well, and it's a great story.
We'll tell Sean at this point, Janine's coming over, and he'll say, Janine, whenever he gets a little boo-boo in the house, Janine, even she's not here, so he expects her now, he expects her to come over, he loves her.
So some of the qualities that Janine has displayed with this particular case is her caring, her ability to look at the big picture and see some of the things that she could help with that may not really be what others may think as, her role. And, she has helped to get a crib for the family through the Children and Family Health Institute. She reached out to appropriate resources and was able to see a need. And again, is that the job of a home nurse to get a crib for a baby? Most people would think no, but Janine thinks yes.
We could tell you a million stories, and they're very adaptable, they're flexible, they're very compassionate, they're very true to their hearts.
The Many Hands, One Heart theme really embodies nursing.
Because it does take many hands to get a person to wellness and to help each other.
It emphasizes our individual strengths and yet the expertise and passion to come together with one heart, one focus to dedicate to patient care.
First and foremost, I just want to thank all of our nurses for their service to our organization, to their patients, to their communities. The work you're doing is indispensable. The world is a better place because of what you do.
I want to say to all our nurses a very big thank you for their dedication, commitment. They're inspiring.
We're in the best career in the world. We're helping people. We're trying to work with people. You cannot beat that. There's no way to beat that. There's nothing else where you do that in the same way that we do as nurses.